we inherited an electronic system that an agreement was signed in 2019. The contract sum was $100 million. They were supposed to connect about 950 health facilities. The contract was supposed to expire 3 years later, so that will come to 2022. At the end of 2022, they had not connected all the 950. Some other reasons were given for the underperformance. Now, the government then extended the contract to expire in 2023. 2023. At the end of the 2023, again, not all the 950 facilities had been connected. The government again extended the contract to expire on the 31st December 2024. So something that originally was meant for 3 years has been extended to 5 years. Now, out of the $100 million, about $77 million has been paid. Now, when we came, under normal circumstances, the contract was divided into what we call milestones. So when milestone 1 is completed, it must be given to the state before you even go to milestone 2. And that was what the ministry or government should have insisted on before even allowing the next milestone. And that was not done. And so when we took over, when the contract had expired, so issues of abrogation or termination doesn't arise because there was no contract. It doesn't arise because there was no contract. Now, what we said was that before we take over, we must know what we are inheriting. And so a forensic audit was conducted, and we saw a lot of gaps, especially the hardware. You realize that issues of quantity, issues of quality of materials provided were not up to specification. They quantified that, and that was about $18 million. There were other issues. Again, as part of the third milestone, they were supposed to connect about 157 facilities. And the government paid about 10 point something, almost $11 million. That, again, shouldn't have been the case. Because, it's part of the 77. Because it is not meant for pre-finance. You execute the contract and you pay. But the government at the time paid. So out of the 157 health facilities that must be connected, only 7 were verified. 7 were verified. And so today, it will interest you to know the immediate past health minister clearly admitted in his his write-ups and circulating that the contractor has been overpaid. I'm not saying it. And so when we came, we said, wait a minute. Now there are gaps. I invited him to the ministry to have a conversation with him, because under normal circumstances, we should have access to the data. And Mr. Chairman, in all this, what is very important and sensitive is not even about the gaps or the money issue. It has to do with our data and access to our service. National security is a national security issue. So what we said was that you should have handed over to the state. Now, the state doesn't have access to our data and our service. And so we are ready, because the software doesn't belong to the state. It's his property. And that's another sensitive issue to deal with. And so no problem. We'll sign what we call service maintenance agreement with you for 2 years, so that we will not experience the disruptions we are experiencing at the moment. When we got that, but before we do that, give us access to our data. Give us our service. The contractor or the vendor insisted that if we don't take issues of data out of the contract, he was not going to sign. Yes. Mr. Chairman, at this point, let me put my CEO for National Health Insurance on the spot. He was one of the people who led this negotiation. I didn't seek his permission to put his name out. That's why I'm saying I'm putting him on the spot. He was one of the people who led this negotiation. Because at a point in time, I had used all diplomacy, so I had to stay back in the interest of the country. That's why you don't want to know the other tangentials. But I had to stay back to push some of my CEOs. Mr. Chairman, for your information, we were not dealing with a reasonable human being. And so he said we should take that one out. And again, instead of us verifying 450 health facilities, he says, no way, put in 461. Yes, that's why I have cited a witness. He said, we can't do this. In all this, we were engaging him. But what we realized was that the country was virtually begging him and switching the thing on and off because we had no solution. At that point, I had to take a bold and courageous decision to find a solution. And what is the solution? The solution is that the country must own the software. And even if the country was not owning the software, and we had created a middleware, an exchange, where any vendor will plug in, even if any vendor is bluffing, we could have secured our data. We didn't have that. And so, for the past 2 weeks, Mr. Chairman, the whole system has been switched off. And that is why you hear issues of National Health Insurance card were not being verified. Mr. Chairman, you hear issues of we are going back to the paper system and all that. So, Mr. Chairman, what I think is important and Ghanaians must know, and Mr. Chairman, we didn't respond to all these things because we thought that it was not for the ministry or the minister to come and lament. We should have solutions. Mr. Chairman, we had no option than to engage and to have a software that is for the state. So we are working on the software that is for the state, which is now, instead of the LIMS, which is the Lightwave Health Information Management System, we are working on Ghana Health Information Management System that the state will owe. Now we have put in place the middleware that even if we are inviting more vendors, they will come and plug into the system and that the data will be lodged into it. Now the second leg of your question about the remainder, the 500, because he has not done the 500, and one of the issues why we are where we are is that the system was monopolized. If there were about 4 or 3 or 2 vendors, maybe if he's maybe squeezing our balls at this point, the others may not. And so going forward, the decision is that the 500 left, they are going to open up. But we have to deal with this emergency situation. So what we have done is that we are rolling out the software. We have a 4-week plan. We are doing the piloting. All other agencies are on board. Medical superintendents are on board. CEOs of the various agencies who are interested parties are on board. AG on board. Yoko on board. NITA on board. All other cybersecurity, everybody is on board. Where we have to retrieve what belongs to the state, the appropriate agencies will deal with that. For now, the ministry's target aim is to look at how we can get out of this mess, Mr. Chairman. Thank you very much.
Minister, you see the platform I gave initially, you were reluctant to respond. But you see, this platform is for free. You are not paying any money, you are not paying for any item 13 because, it is here and we are taking care of all that. Yes.
You know you are Abena
No,
and I'm Kwabena. You are Abena and I'm Kwabena.
Minister, there's one thing you mentioned that the minister said, the former minister said, the vendor has been overpaid and it's in... I
have a write-up. Seth, if you are here and you are listening to me, please give me my file. Mr. Chairman, today I woke up to a response from the immediate past minister.
Okay.
And Seth, are you here? I woke up to a response from the immediate past. And if anything at all, you should be keeping quiet. It's not in his interest to be talking because he overpaid the contractor.
Minister, respectfully, if you can go straight.
So yeah, I read.
So, yes, because he's not here. Yeah,
this is one of the things he said. He said that payment have been 62% from the Ministry of Finance and 68% from the National Health Insurance Authority, totaling 76.99 million paid. So he has admitted that about 77 has been paid. And $23 million outstanding. Now hear this. As of December 2024, reconciliation showed an unutilized advance of 10.6 million yet to be expended by the vendor. And he is the one who paid this. Why should you be talking?
So, Minister, well, this does not translate into the person being overpaid. I thought you said the person put it out there that he said an advance has been given, but it hasn't been utilized.
No. Mr. Chairman,
yes.
This is not a prepayment procedure. So you pay as and when you have executed the job. So if you are paid more than the work you have done, you have been overpaid.
And you said the minister said that.
Yes,
yes.
For
me, that is what I want to establish. The former minister
so
said that
should not be
the
created
vendor
as though,
has been overpaid.
Yes, Mr. Chairman. So the impression should not be created as though saying this doesn't mean overpayment. That's number one. That impression should not be created. And then maybe he should come out to say he didn't write this. But this is what he has written.
Since this has come up at a Public Accounts Committee meeting, which is live everywhere, Minister, if you could give us a copy of that so that it will be part of our files. The minister's tender a copy, the document that you read from.
No problem. I can staple them together.
You give us a copy.
It's been titled, what is the title?
That will be in our files. You can get it later and give it to our clerk.
Okay, so it's been titled The Limbs Controversy, a case of giving the dog a bad name to hang it. That's
yes.
The title.
So when we get a copy.
No problem.
Okay.
And it's signed by?
No, I didn't say it's signed. I said this is what he has put out there.
And is it in the name of them? You mentioned that it's in the name of the immediate past minister. That's why.
Yes. So
it has that indication on the document.
Yes, it has that indication on there. It says a former Minister for Health, Dr. OkoeBoy writes.
Okay.
So. Okay. And it's all over social media. I mean, Ghanaians listening to me know.
Well, I haven't seen it, but we'll be happy to have a copy of it.
You are the only person who have not seen it. You are the only person who have not seen it.
Minister, I beg your pardon. That is not the case. I'm sure there are quite a number of us here who haven't seen it. But I'll be happy to have a look at it and then, we can take that.
Minister. Minister, thank you for the explanation. Honorable Kwabena Akando, thank you for the explanation. And as you rightly pointed out, you saw this thing on the internet. It could be the case that it wasn't written by the immediate past minister. So I will plead that we'll disregard that until we can authenticate that it's coming from the immediate past minister. Number two.
Honorable member, that's why I said we need a copy to be on our files.
Yeah, I wanted to place emphasis on it for everybody to know that it's just, he saw it, OkoeBoy writes.
Mr.
It
Chairman,
could be anybody's.
I said so. I didn't hide it from the committee.
Yes.
It's exactly what I said.
So that which is very good. But my point is that you shouldn't have made another comment on that. We heard you.
Mr. Chairman, you know.
No, we heard you. No, we heard you right. So
yes.
For you to have said you shouldn't have done it, you
Mr.
went
Chairman,
extra mile to have said that you shouldn't have done it.
Mr. Chairman,
meaning that if
I don't intend this banter.
No.
I put it on
okay,
record that I was not even going to.
Okay, Minister, that's fine.
So, yes,
that's fine.
Yes.
You said what you said. Ghanaians are listening, so we heard what you said. So let's move on. So let's move on, please. The second one is, you said you've gotten another contractor to continue the project. Did I hear you right, please?
Mr. Chairman, unfortunately, I didn't expect this. If I was going to do this, probably you would have informed me in advance to bring the necessary documentations, and I thought that I was going to take the opportunity to explain to you what really has happened. So, Mr. Chairman, I with a great deal of respect, where I've gotten to, if you indulge me, I think we will leave it here.
Yes. Honorable Minister. No, it's a question you can answer. You ask him if he has another contractor or not, yes, right? On the project.
Yes. Mr. Chairman, you've gotten some Ghana, something. Unless you want to retract whatever he said, then I will also take my question back.
Ask him a question.
Yeah, he hasn't answered.
Okay, he will answer.
Thank you.
Mr. Chairman, if you need any better and detailed particulars on this matter, I can assure you, you can invite me at any time and I'll appear.
Thank you.
Thank
so
you.
that's his answer.
Chairman, sorry, please. Is it
That's
the case
it, that's
that
his
is it the case that he's retracting whatever he said?
No.
Until
No. This is live. We all know it. He says if you want better and further particulars on the contractor or whatever is going on, he's ready to give it to
that's
us.
good. Thank you very much. The reason why I asked this question is the fact that he, please, Honorable Akando, please, Honorable, please, Honorable, please, I know. He spoke about the fact that the contract, the first one, wasn't done properly, if you like, among other things. So I wanted to make sure that this one is entered into was done the proper way, so that we will not go back to the same problem again.
That wouldn't be the for Public Accounts Committee to find out whether he did it right or wrong. What we are asking for, no. He said, look, the minister said, if we want further information on it, he will provide it. And after he's provided that, then we'll see whether he did it right or wrong. Isn't that so? All right, Honorable Gape.
1 minute. Minister, Mr. Rankin is here saying after what we will ask for you to provide, but it's just a word of caution. That, as you said, you needed to get a vendor to bring about solutions to the issues you were facing. Please take note that it's today, it's immediate, you needed to do something. When COVID came in 2020, we needed to do something quickly. At that time, everybody saw the urgency, the need to sort of cut short some steps and then get to solutions. Today, it may be the same thing, but I'm only urging you to be very cautious, because today we understand, we are in it. We need that data, because what is the use if you can't have your previous history when a doctor needs to take care of you? But tomorrow, after the problem or the solution has been found, nobody will remember that it was urgent, and so you needed to do some things to cut short certain processes in the procurement chain. So this is just an advice to you, because I have seen some before. In the COVID era, we needed to cut short certain steps to provide needed essentials to our citizens. So, and it's the same, it's a similar thing, because I can imagine patients going to the hospital without their history, and it will be frustrating to them and even to the doctors who are taking care of them. So this is just a cautious a message to you, that in you coming out with processes and solutions, to solve this particular problem, let's look at the processes so that 1-2 years later, you don't have to appear here saying that you being cited for a breach in the procurement process or any other thing that will warrant the ministry to be called before public account. This is just a note of caution.
Chairman, this is a fantastic advice, and I appreciate it so much, and I will be religiously be guided by that. But Mr. Chairman, just to add, it was not in anybody's interest to even, some of these things are national security sensitive, not in anybody's interest to even put some of these issues out there. Mr. Chairman, when you go to a ministry and you are solving problems and stories are being planted in the media as though you are creating the problems, if you decide to keep quiet, you dig your own grave. So some of these explanations are sometimes needed for Ghanaians to understand what you have inherited and how you are solving the situation. It is not, the story has been planted for a very long time. We just came out 2-3 days ago. And so I thank the honorable member so much for her fantastic advice.
All right, the Honorable Gape has a question.
Minister, thank you very much, being courageous and being factual. And then fact is fact. And then you brief the committee on better and further particulars. Thank you very much. This is a public interest question. Health insurance vis-a-vis your ministry, there are services they are providing, but patients are still paying. For instance, like pregnant women, but free maternal care. And it is happening all over the country, especially when you look at Joy FM documentation on pay or die, it is evidence. 37 Okoe teaching hospitals, and then their patients are still paying for services that's supposed to be free. I would like to ask you, what strategy or steps are you taking to address this for Madagana?
Okay, Mr. Chairman, when you are put in a public office, you identify challenges and your responsibility is to fix the challenges. When we took office as a government, some of the challenges facing national health insurance, one, was the delay in payment, two, the capping, three, unrealistic payment of tariffs, and then the fourth one is what they call, they've given it a very nice name, but it's not a nice thing, co-payment. And so when we took office, we've taken our time to be taking the problems one after the other. Now, new tariffs have been developed. Now the uncapping has been done. Now we have prompt releases. What is left, and I must be very, very honest with the committee, is the issue of co-payment, where in some cases when you go to some facilities, though you have the National Health Insurance card, some of the facilities will be asking you to pay more. We have not completely dealt with that, but plans are far in advance. We have stakeholders engagement. It has come up strongly, and so I will allow the CEO to throw light on the strategies we are adopting, what we are doing at the moment to deal with the issue of co-payment. CEO.
Thank you, Chair, and thank you, Honorable Minister. So as Honorable Minister said, there were a few issues that were bringing this up. The irregular payments, which now we're paying monthly. The service and medicines tariffs have been reviewed. The medicines tariffs are now realistic and have been in place since March this year. The service tariffs will be implemented in a few months after Honorable Minister and the board approve it. The third one is that even despite us doing this, as what has been mentioned, some of the facilities have people who still collect monies, and they call it co-payment or top-ups. We've set up a committee to deal with this, and we have a strict sanctions regime. So once we are also doing our part, paying regularly and paying realistically, as soon as we realize that these facilities are collecting monies which they term co-payments, which are illegal payments, we will apply those sanctions that are in our law. And it could include getting them off this scheme, which is a very important scheme. So we want to actually also name and shame. For example, I want to put it on record that Okoe Hospital, they have clearly stated that they will not allow top-ups, and they are implementing that. So we are encouraging the hospitals, and there are quite a number of them, we are encouraging the hospitals that have put this in place, and we will sanction those that are doing the wrong thing. Thank you, Chair.
Please, what is top-ups in the hospitals? Yeah.
So it's the same as, they have different names, so it's the same as the co-payment and the illegal payments.
You mentioned co-payments as if it is legal, so that's, I like the way you say illegal payments. They also, you don't even call it co-payments, illegal payments, because you are not supposed to pay if you have a working insurance card. Right?
So, yeah. Mr. Chairman, let me use your platform and this opportunity to commend the Okoe District Hospital highly.
This is free.
It's free. Let me use this opportunity to commend Okoe District Hospital highly for the strategies they've put in place to make sure that co-payment is not happening, and to assure the committee and the whole country that we are coming after the facilities who are tolerating co-payment in their facilities. So when it gets there, it shouldn't be, I can't, no. Thank you.
Yeah, so Minister, thank you very much. Based on what Okoe Hospital is doing, I think other hospitals, it's a role model. So you need to not go beyond the recommendation and do something nice for them to project them as a best practices for the country. And also to the National Health Insurance Board, apply the rule. Enforcement of rules and the laws is killing this country. And I will implore you to enforce the law strictly, and then so that at the end of the day, to serve as a deterrent for Madagana, because the lot is being wasted in the system. Thank you.
Minister, UNC Government Hospital is waiting for you, as well as the 100-bed District Hospital in Name. We are in your hands. You understand what I what I mean.
Very well,
Thank you.
Mr. Chairman.
Hey, you know how it is. Everybody knows how to do your job. Oh. So they get there. Then they ask for the front door. Where is the front door? Okay, NHIA, you are discharged.